welcome. I'm Steve Clemons, editor-at-large of The Hill. Thanks so much for joining us for our virtual event today titled Advancing Health Equity in Our Nation's Opioid Response. September is National Recovery Month, a good time to take a look at the current state of the opioid epidemic and examine what solutions are needed to get all American communities the help they really need. Before we begin, I'd like to thank our sponsor, Indivior, for its support of today's event. In the age of COVID-19, the opioid epidemic has taken a sharp turn for the worse. According to the CDC, drug overdose deaths in the United States rose by nearly 30% in 2020. These are huge numbers, the largest single-year increase ever recorded. Consequences of both COVID-19 and overdose crises have hit vulnerable populations particularly hard, and unequal access to addiction treatment really continues to persist. How are we addressing the pervasive disparities in access to treatment? And what changes can be made to the way the justice system responds to opioid use disorder? And how can leaders put in place solutions that tackle these issues and really get at the stigma surrounding them? To answer these questions and more, we've got an exceptional lineup of speakers. Before we get underway, a few housekeeping notes. You can tweet us at The Hill Events, that's at The Hill Events, using hashtag #TheHillOpioids. We're broadcasting live and we'll take your questions throughout the program. We already have some, so thank you for those. As with any live stream, you could experience some trouble with the video. I hear that all you have to do is refresh the page and that will automatically fix all your problems. Never works for me, but I've been told it'll work for you. My first guest is Congresswoman Lisa Blunt Rochester from Delaware, a member of the Energy and Commerce Committee. She also serves on the Bipartisan Heroin Task Force. Congresswoman, it's great to talk to you again. We've talked about other issues, energy, infrastructure. Now we're talking about something that is so deep in this country right now. And you're in Delaware. I have a home on the Eastern Shore of Maryland. I see the campaigns to go purple, to try to find ways to get people unified, to look at the social dimensions of responding on opioids and addiction in general. And I just love to kind of understand from what you think are the missing pieces of a strategy to reverse these numbers.
Well, first of all, thank you, and also thank The Hill for a focus on advancing health equity in our nation's opioid response. I think a lot of times, people don't think about this necessarily as an equity issue, but it does affect so many parts of our communities, whether it is people of color, whether it is youth or justice-involved citizens, or even moms. Like I have a bill called the Moms Matter Act, which focuses on mental health and substance use disorders. And ultimately, this is connected to our employers as well. And so that issue of equity is really important. And as you stated, pre-pandemic, we know we already had challenges with the number of drug overdoses. You mentioned the 30%. But I'll say, just so people can get the numbers, it's over 93,000 deaths.
Right.
And, you think about it, in the beginning, we had a challenge, but the pandemic has exacerbated that for many states. And so I think what we need to do, just as a federal government, is that we must have a coordinated and an evidence-based response. And I'm so glad to partner with my colleagues like Representative Annie Custer and Senator Warren and White House and Markey to introduce the Stop Fentanyl Act of 2021. There are different components to that bill that we can talk about, but there are also, again, different lenses through which we must come at this in a coordinated fashion, because it's touching all of our lives, all of us.
Representative Rochester, one of the things that just always plagues me when we get into conversations with this is how we have communities that are just off the track of access, where you see the burdens. Let's just be honest, 93,000 deaths. There are a lot of people, in those horrible numbers. But why is our society, our outreach, our support for vulnerable communities, which is prison populations, communities of color, why are we so bad at it? Why are the cards stacked the way they are, and how do you unstack them?
Well, I think one of the ways you unstack them is, number one, through education. Our Stop Fentanyl Act is focused on educating people on what is actually happening, what resources are available, and really better monitoring and using the data to share. Another thing is to address, things like stigma. For many of us, we know that even this issue of opioids, I remember when I signed up to get on the Heroin Task Force, and a lot of folks were like, oh, well, is this an issue for people of color? No, it's an issue for everybody. And I think that, number one, getting that data, understanding that all populations are affected by this is a big start. And number two is that we really have to put our money where our mouth is, whether it's prevention or treatment. When we have the data, we can better target our resources. And so I think those are some of the things that we need to specifically do. By putting forward this legislation, by having a bipartisan effort, that makes a difference as well. I have one bill called Clean Slate that really deals with background checks and allowing people to, kind of get back to work or to a job or to a home, or a lot of times the background check stops people. And it's an opportunity to give people a second chance. And so when we even look at the justice-involved community, making sure that in our prisons, before people are released, that they get the medication that they need and that it is available to them, that's one of the portions of our bill. So I think you'll see increasing school-based health centers, making sure that's something we've done in Delaware, making sure that we get access to information, education, and treatment. And then even having mentoring, peer mentoring programs is another one of those strategies that we have found works and that we need to do more of. And so I think when we're intentional about who we need to make sure gets access to this information, then we are on a better road to success.
One of the things we're focusing on today in today's discussion is we've been coming back to this repeatedly on what the nation needs to do to address this epidemic, but is on treatment and care. And so we look at treatment and care, and I guess I'm going to ask an unfair question, right? Because I'm trying to learn as well and understand what's going on. But the ease with which opioids were distributed in this country, I think somehow needs to be matched by an ease of getting care and treatment. How do we make that the obsession of our socioeconomic political system, to make treatment and care front and center, to kind of do battle with the access that people have had on opioids? Does that make sense, or is that a stupid question?
No, it's a great question. I mean, it kind of dovetails into what I was sharing before, that you make all the different entry points. That's one of the areas that in Delaware we have been trying to focus on, is to make sure that all of the areas of intervention are roads to treatment and recovery. And, even in our bill, something that people might not have thought of, but we have a federal Good Samaritan, protection right now. We want to make people immune so that if you just want to even help somebody who's overdosing, you have the ability to do that and not be afraid that, you're going to then be in trouble. So I think that, no, you ask a really good question. And I think that is the point. We've got to make that front and center, that it's access to treatment, it's access to prevention, it's access to education, and it's getting rid of the stigma that is associated with it as well.
I want to take a question from our audience, but I want to squeeze in one other quick one. The Biden White House has so many, I'll call them hot potatoes, that they're constantly dealing with, so many priorities, go from climate to Afghanistan to all different. I know that this is a priority, but do you think there are any missing elements, of the Biden strategy on this that, in your discussion with the White House, I know that you're probably pretty well aligned, but are there any things they can do better than they're doing now? Any points of attention they should be giving that you would recommend that they give?
One of the big points of attention that I think our bill focuses on, and we've actually had conversations with the administration, is as we look at this issue of fentanyl and how pervasive it is. I mean, I was talking to, a couple of students, even in my state, and they were saying that so many people are getting, addicted to that. Looking at this issue from the lens of public health, as opposed to just a criminal justice. And that's an area that we are very much aligned with this administration on, and we have been working with them. And it actually is exciting, because it means that people will, again, back to reducing that stigma, back to making sure that the services get to the places that they need to be. When we look at it from this perspective, then we also are not overburdening our criminal justice system. We are looking at it as a public health issue. And I think that we're aligned, and I'm glad to see that's the direction, and that's where we'll be heading next.
Well, thank you. Well, we've got a good question, I think, from Don Mathis. Don?
I'm Don Mathis, a peer recovery specialist with Voices of Hope in Elkton, Maryland. I want to thank the Hill for this opportunity, and I also want to commend Congresswoman Lisa Blunt Rochester and Congressman Mike Turner of Ohio for their leadership on this issue. I know both their communities well, having taught at Del Tech and spent a lot of time with the Community Action Agency in Dayton. My question to you both is, how can we, people and families who experience the trauma of substance use disorder, help you make a better case to your colleagues in Congress and the administration to provide adequate funding for prevention, treatment, and recovery programs?
And Don, I want to say, I don't know if you did this on purpose, but I've been, kind of educated that communities are trying to come together using this purple as a way to kind of tie people together as part of a symbolic, gesture forward to bring people together. So I don't know if you did it on purpose, but I appreciate your purple shirt. But go ahead, Representative Rochester.
Don, I appreciate your purple as well. I actually am in an eggplant purple from head to toe, even my shoes. And I want to say, first of all, thank you so much for sharing your stories. Thank you so much for the work that you're doing. I think that just the presence of individuals. I just attended a huge rally in Delaware on Overdose Prevention Day, and there were so many different partners from so many different walks of life. And I think that again, demonstrates, for myself and Congressman Turner, that this cuts across all backgrounds, all political persuasions, and that we're in this together. So continue to keep pressing on all of us to keep this as a priority, and know that your work is not in vain, and that the efforts that we do for our loved ones are also not in vain. So thank you so much, Don, for your work. And I'm looking forward to working with Congressman Turner. I know he also has legislation that we support as well. So thanks, Don, for your work. And we're going to keep pressing on.
We're going to talk to Congressman Mike Turner in a minute from Ohio, but I want to thank Lisa Blunt Rochester, representative of Delaware, and she is co-author. She's introduced the Support, Treatment, and Overdose Prevention, or the Stop Fentanyl Act of 2021. Thank you so much, as always, for coming to talk to the Hill, and we look forward to other. But thank you for your work on this.
Thank you. Take care.